have the privilege this week, all this week, to have Dr. Harrison Mungal with us. Welcome back to 700 Club Canada.
Thank you. What a privilege and honor to be here.
Right. And you know what? We always enjoy having you. It's been a while.
It's been a while.
We are glad you're here because you're going to hang out with us throughout this week. And I'm looking forward to learning from you.
I'm looking forward to the same.
But first, I want to catch up.
Sure.
How many kids do you have, Harrison?
7.
7 children. Did you hear that?
Children.
7 children.
7 amazing children.
That's awesome. And grandbabies?
And grandbabies, we have 2. We have 5 married, and
Wow.
we have 2 grandkids. And
yeah, it's amazing. That's amazing. Well, I have 4 grandbabies.
wow.
And ready for more. That's all I can say.
Same here. We're ready for more.
Right? Isn't it the best job in the
I
world?
wish God give us grandkids before He give us children.
I
You know,
right? I know, it's so true. But, well, you are such a blessing to so many. And when I said prolific writer, I mean this. We're going to talk about one of your latest books, Soul Care. We'll get there in a minute. But these books have recently been written. There's over 30 books that you've written.
Over 30 books.
Where do all these messages come from? I mean, there's leadership, there's, mental health, right? There's relational health. I mean, so many topics to help people. You write, you speak as a motivational speaker. Where does it all come from?
Well, one of the things, as we were talking earlier, I really believe God aligned our life, with the right people to glean from them, to get information. 21 years working in mental health, psychiatry work, and being able to support individuals today and seeing the brokenness of people. It's like I felt like, why should one person hear it on a session? The whole world needs to hear it.
Right.
So 1 hour a day.
Yeah.
1 hour a day, put your thoughts together, put the book together. You'll be amazed how quickly you'll write a book.
Well, like you said, I mean, this didn't come overnight. You've spent years studying. You have a few degrees under your name,
Yes.
which is a lot of work. There's a lot of commitment, but that commitment to write it down, thank you for doing that. Because I know you watching, myself, we all have lots to learn. And, today we're talking about conquering fear. I'm sure you see a lot of people in your practice that are struggling with fear.
Yes.
Like, what is underneath this fear in our life? What's one of the primary challenges for people to overcome fear?
First of all, I think people need to understand that fear is really, that thought of the unknown, not knowing what's going to happen. And, as believers, I also believe there's a spirit behind fear that tries to cripple the mind.
Yeah.
When people are then living in a life where a lot of things can contribute to that fear mindset that gets developed, and it's almost like they get trapped in a world that needs to be broken.
Yes. What are the things that contribute to that fear mindset?
I think, a lot of it is, as I said, like the different stresses that people go through in life, like people have financial stresses, relationship uncertainties, so many unstable things with their jobs.
Right.
That's another big aspect for fear that comes about. I think, a lot of times with the patients I see right now, it's a lot of their past affects, are triggered by their current future, and that kind of like holds them back, and they have this fear in their mind of, can I really step forward? Can I move on with life? So there's a lot. It'll take a couple sessions.
Take a couple sessions. We've got him here all week, so I'm going to work you for sure. So if somebody comes in, they're struggling with fear, and you say there could be things from the past that's holding them back. It could be circumstances in their life. They don't see hope for the future. What would be even one step or 2 steps that you encourage people to take in order to move forward? What's even one thing that they encourage you to do?
Well, from a clinical perspective, the goal is to really recondition the mind and restructure the way we think.
Right.
And putting 1 or 2 things together, it's a process. When individuals come to a place in life understanding that they can draw the line in the sand and say goodbye to the past and really focus on the future, fear would be able to let go of their lives. Because when I deal with so many of individuals who are struggling with fear, and as a result of fear, anxiety comes, panic attacks, triggers of PTSD. There's a whole, it's more than just fear. I guess that would be the right way to address it.
Yeah.
And so putting one thing, of course, as a believer, I really believe, and I've seen how prayer breaks that fear that tries to swallow people in some ways.
Yes, yes.
But practical things is very important. Like people need to learn that unless they don't step out from that grip that they're
Yeah.
holding on to, they wouldn't be able to be set free.
100%. You know, I wasn't the first one to say this, but one of my favorite phrases is do it afraid. You have to be able to step out in fear.
Yes.
Fear is a normal emotion, and that can bring benefit in our life, but not to be debilitated by it, as you
Right.
say. And stepping out in fear, sometimes it often begins with prayer. We're going to come back. We're going to talk more about this. And we're going to talk more about your book, Soul Care, Understanding Spirituality and Mental Health. Wow. There's so much good things in this book. So we'll be right back to discuss Harrison's latest book, Soul Care. Well, the doctor's in the house, Dr. Harrison Mungal. I'm learning already. You've written a book called Soul Care, Understanding Spirituality and Mental Health.
Yes.
I think this is a very important topic. Why did you write this book?
I wrote this book actually because someone had asked for me to do a conference for about 400 ministers of Canada to talk about this topic, because there are a lot of individuals who are struggling in terms of, is everything mental health, is it a demon or is it spiritual?
Right.
And so that's kind of where the thought process evolved. And knowing that we were made body, soul, and spirit, you know, the church has been focused a lot on the spiritual part of man, and also to some extent the body, the physical, but the soul, which incorporates the mind, the will, and the emotion. I think that's a part that was lacking in terms of understanding, having a better understanding about it.
Well, I think it's really good. And as I read your book, you're right. It's not to dismiss the spiritual aspect of
Right.
mental health, which I really appreciated that, because that's a real factor, which we'll talk in a minute. But we're complex beings, body, mind, and spirit, as you said, body, mind, and soul. And so as we look at the soul of a person, the mind, the emotions, the will,
Right.
you know, this is just such a healthy way to understand how humans respond to things in this life. But if we can address for a minute, what you say, not everything is a demon,
Right.
but what is the role of the enemy, Satan, and the demonic in our health, physically, emotionally, mentally, spiritually?
Well, you know, how I look at it is, when someone have cardiac issues or hypertension, are we going to say that's a demon?
Right.
Right? You know, we know that everything on a negative spectrum is as a result of sin. It influences sickness, disease, everything that is on a negative nature, even our mind, those thoughts.
Yeah.
But it doesn't mean that it's a demon, which is
Right.
very different than something being influenced.
Yes.
You know, like when I think of a broken bone, you go to the physician and the physician would say, hey, you know, you have a broken bone, you need to put it in a cast. But the problem is that's just part of the issue. The issue is the trauma that comes with the broken bone.
Right.
And that trauma is not a demon. So that's kind of where the book tried to give the readers an understanding that we need to be smart.
Yeah.
Right?
Yeah. Yes. And I think that's so good, because everything impacts. We don't just isolate that's physical and nothing else.
Right.
That's mental and nothing else,
Exactly.
right? I mean, you address an interesting topic in this book, generational illnesses, which I found very interesting. Explain what it looks like, and is there a way to address generational illnesses? Like, is this a real thing?
Well, you know, when I look at generational illnesses, I look at it, you know, like from a medical perspective, people who have diabetes and medical health issues, a lot of it is hereditary.
Right.
Doesn't mean that it's a demon traveling through grandparents to parents. It is just a factor of the foods we eat, or the culture, or the whole environment that generates different form of medical illnesses, just like mental illness.
Right.
I mean, how many of us whose parents, like my dad, for example, I'm sure he wouldn't mind me saying it on screen, but he was an alcoholic until he became a believer in the kingdom of God. And it was very easy for me to become an alcoholic because my grandfather was.
Right.
So that I see as a generational, just like mental illness, depression, anxiety, psychosis, all of those things are also hereditary in some sense. But the good news, the good news is that we're in a time and age where we understand that Jesus can heal every form of
Yes.
illnesses.
Yes. Yes. And Jesus cares about all of our being.
Exactly.
Physical, emotional, mental, spiritual. I love that.
Yes.
You know, we have emotional wounds you talk about in this book, which are significant at times, you know, whether they've come through trauma. And healing, you talk about, takes time and care. I really loved how you address that. What can a person do then? They're carrying this emotional hurt and wounds. What do they do with that in their life?
Well, you know, like emotional wounds are so, the best way I can address it is that when someone get a physical cut, if it's not taken care of, that cut can get infected.
Right.
They go to a physician, the physician will open up that cut, which can be very painful, take out all the particles that is causing the infection, and then be able to suture that cut. Well, we know that God is the healer who heals it after it's sutured.
Yeah.
But the healing doesn't stop there, because 3-4 months later, now there's a scar. And every time the individual see that physical scar, is like they get traumatized from the cause of that scar.
Right.
Now think about it from an emotional perspective. When people are, have been abused in whatever way, whether it's sexual, physical, emotional. Some people have experienced trauma from a very young age. Some people have made mistakes, like we all do, and have regrets, and you know, we feel like as a result, and I come back to that statement, we don't have the value.
Right.
The process that needs to take place is we need to be able to get proper care. As much as we go to church, and I believe God 100% for healing, which God can do, sometimes it's okay to reach out to a therapist.
That's right.
Let them open up that wound that is causing the infection, and then see the process of healing that takes place. So when they look at the scar, they can say, hey, you know what? Jesus has delivered me from that.
Yeah, that's right. And I love how Jesus provides medical care and emotional care through therapists. We're going to continue our conversation. Thank you for being with us all this week. I so look forward to learning. I'm sure you do too. And we're going to continue it even at the end of this show. But for more information on Dr. Harrison Mungal and all of his books, you can go to 700club.ca.